Good evening, everyone. A very warm welcome to this session on the Nat Health, the Leadership Outreach Series to our frontline workers. This is an interactive video session where the healthcare leaders come together. They take questions on this show, and these questions have been posed by the frontline health workers. We have gone out, we have reached out to many of the healthcare champions, and we take some of their questions, and we also pick up any questions that come during the show live. We are very, very fortunate today to have a doyen of the healthcare industry, a very eminent leader, Dr. Nandakumar Jairam, here with us. Dr. Jairam is the chairman, CEO, and the group medical director for Columbia Asia Hospitals, India. Dr. Jairam was the chairman, CEO, and the group medical director. With the merger of Columbia Asia with Manipal, he will now move on to an advisor position shortly. Dr. Jairam was the chairman of the NABH under the auspices of QCI, which is the Quality Council of India, and the past chairman of the Health Services Committee of FICCI. He was a member of the Health Insurance Forum of IRDA and FICCI. He's the founder member of Nat Health and secretary of GAPIO, as well as the founder trustee for Terry Fox Foundation, Bangalore, until its existence. He also founded the Krishna Charitable Trust. Dr. Jairam has been a recipient of many coveted awards, including the Health Personality of the Year Award of FICCI and the Alert Award. Till recently, Dr. Jairam was a consultant, colorectal and general surgery for Columbia Asia. He's also responsible for the development of the self-help group for ostomy patients and was the vice president of Ostomates India until 2007. He was the chairman Health CII Institute of Quality from 1999 for a period of 2 years. He also led the delegation of health professionals as his chairman to England under the Indo-UK Partnership Treaty. From 1996 to 1998, he was the medical director of Malia Hospital, Bangalore. Dr. Jairam was secretary of a charitable hospital, the Dhanavantri Hospital, between 1997 and 2000. Between 1980 and 1994, he served as St. John's Medical College and Hospital, firstly as lecturer, later as assistant professor, associate professor, professor and head of surgery, and member of the board of administration of SGMCH. Dr. Jairam is trained in colorectal and minimally invasive surgery. He has spent time in UK and the US. He attended a course at St. Mark's Hospital in colorectal surgery in 1986. He is an alumnus of Bangalore Medical College, National College, the Vasanagudi and Bishop Cotton School, Bangalore, India. He has been an examiner for MBBS and the MS examinations of several Indian universities. And he was also an examiner for DNBE in surgery and inspector for the National Board. He has several papers, including publications in the prestigious British Journal of Surgery and presentations to its credit. He was awarded the FRCS in 2017, awarded as the Healthcare Personality of India by FICCI in 2017, and the Lifetime Achievement Award by Alert in 2019. A very, very warm welcome to you, Dr. Jairam, to this particular program. We are very thankful to have you.
Thank you, Siddharth. Thank you for having me. It's a pleasure to be here.
Sir, we would like to, dedicate this session, straight away into the questions that have come in from the front lines. As you are aware that over the last 14 to 15 months, this has been an unprecedented journey. As a whole, for entire country, but mostly for the healthcare system as a whole, and particularly the frontline health workers, who has been at the tip of the pyramid in the nation's response to COVID. Some of the questions that are coming in from the front lines really has got to do with, where do you see us at this stage of the pandemic? What do you think the future holds for us as a country, and as particularly for the healthcare system that we have? And how in particular do you see the next few months turning out for us? Over to you, Dr. Jairam.
Thank you, Siddharth, and good evening to all the viewers on this program. Thank you for tuning in and also for sending me questions, which I will try to answer to my best capability. Never in my history, and for that matter, in the history of anybody alive today, has there been a tsunami like we've seen in the last so many months. Yes, we are in the midst of a disease which hit us badly last year, and we have had to look at it in an entirely different way. This was a disease like no other, unknown, unseen, and we had to grapple with several issues to start with. Let me give you a brief about how the last several months from the time the pandemic started evolved, because in there lies the answer to your question. When we were hit with this pandemic last year, the virus was an unknown virus. The way it affected the human body was largely unknown, and we were groping in the dark about how to manage the condition. And there were several attempts to find out which is the best way to treat it and control it. We also did not have any medicine per se to use against it, and we certainly didn't have the vaccine. So it was like going into war without armory, without ammunition, and trying to fight an enemy. Over the course of several months, and thanks to research done at super speed, both on the clinical side as well as on the vaccination side, several things emerged. Firstly, we came to understand the disease, and this is most important. We came to realize how this is to be managed. We came to understand the drugs that will help. And although there was no cure, there were many ways in which one could see that this disease does not affect man to cause death. And prevention of death and complications was something that evolved over a period of several months, thanks to this clinical research and governance in various parts of the globe. But the hallmark is really the speed at which vaccines were produced last year. If you look at this singular event and the many actions that have happened thereof, which I will explain to you, you will understand why I say this. Once the pandemic came down last year and ebbed to some extent, the vaccination period started. The wise amongst the frontline workers and healthcare professionals took the vaccine quickly, but there were some who did not or decided that they would not take the vaccination. Today, those who have been vaccinated are immensely safe. I'm not saying they are safe from the disease, but they are safe from the complications. And this, therefore, is one big protection that we have against the virus. Continued research showed us that the earlier drugs that were suggested, hydroxychloroquine and so on, were of no use. Newer, better molecules appeared, and that continues to be the way forward. But what is clear to all of us is that we've not seen the end of it. And we are not going to see the end of it for quite some time. So how do we prepare ourselves? We have to prepare ourselves in the following ways. Firstly, protect yourselves to the maximum. That is not just the vaccination. You need to take the vaccination. And as we go along, several months later, you will be required to take the booster. And please ensure that that is done in time and effectively. I would also say it is your responsibility to promote vaccination amongst your colleagues, friends, to the extent that will be permitted, to say that, gentle persuasion. Obviously, the decision ultimately is that of the individual. The second is never to ease up on protecting yourself with the mask and cleaning your hands. Believe me, this is immensely important amongst all of you, because you never know which patient is asymptomatic positive, and not all patients are handled with the knowledge that they are COVID. They may be COVID, but still they may be asymptomatic and spreading the disease. These two things are perhaps the most important, and you must follow it to the T in your place of work. You must follow it to the T when you go out socially, and you must encourage your family and friends also to follow the same. Where are we headed? In my mind, the following things will happen. A, there is no doubt that we are behind in terms of vaccinations, but the speed at which the government is working will enable a large number of doses to be available in the next few months. The rapidity with which we, as doctors, healthcare professionals, and some of you who are involved in the process, enable vaccinations will be a big leap forward in controlling this disease. Will we get more waves? The answer is that is unknown, but likely. But the waves will become lesser in veracity and less ferocious as the vaccination numbers increase. I'm sure all of you are aware that now in the US, with the extent of vaccinations that they have given, they have taken away the need to wear masks under certain situations. I do hope that the same level is reached in India, but that is a long way off. And until then, we have to follow this. There is one last and very important point that I'd like to mention, and that is that the next vulnerable group, once vaccinations are given to all of the adult population, will be children. Children get mild disease, and hopefully, and God willing, it will stay that way. But you can never be sure. And the speed with which medical science can evolve a safe vaccine for use in children will be the next step forward. So in conclusion to that question, I know it's a long-winded answer. I would say as follows. Firstly, we are much better off compared to what we were in the last part of the pandemic. We are fortunate that we have vaccinations now which are safe, effective, and good for mankind. We must promote vaccination. We must promote social distancing, masking, and hand hygiene. And we need to be prepared mentally, physically, emotionally for the next wave. We hope it doesn't come, but you can never be sure. How many waves? Maybe more, maybe 5, maybe 6. But there will be an end. And until that end, we will have to fight this virus with everything that we have.
Thank you, Dr. Jairam, for the detailed answer. One of the questions that keep coming back is, this is the amount of stress, anxiety, and the pressure that is building up on the front lines. It shows no, with every wave, when we talk about wave 2, wave 3, wave 4, there is a point where this continues and there is a certain degree of fatigue and stress that is building in the system. What do you think are some of the practical ways we can overcome this stress and also bring in additional human resources capacity into the system, so that the ones who are extremely fatigued, they get a break and the load is shared uniformly across the system, sir?
Right. Stress is certainly a part of every human being's life today in the globe. I would say that it is particularly high amongst healthcare professionals. And let's face it, even I last year have been through considerable stress because I had to watch my frontline workers out there fighting this with little protection. I had to watch families which were suffering because of loss of loved ones. And I had to also lock myself indoors like I have done now and work out of a different environment in a different way, away from social interactions, which is very difficult. I can tell you this. It does affect us. Let's accept that it does affect us. But there are ways in which we can and should fight that stress, calm ourselves emotionally, because a calm mind is the best mind to act. If you have to be thorough in your job, if you have to be effective in your job, you have to have a calm mind. Easier said than done. But I will tell you what I practiced. And I have propagated this across to a lot of people, hoping that they too will benefit from what it did to me. It gave me calm. And I will outline this. Firstly, physical activity. Don't say that, I can't go out and so I can't exercise. You can. Yoga doesn't require more than 10 feet by 10 feet. You can do a lot of physical activity. You can get weights online and create a gym in your house and exercise at least 45 minutes every day. The endorphin challenge that it gives will help you calm your mind. The second thing is, even though social interaction face-to-face is not available, speak to people. There are now virtual meetings that you can have, not just for business purposes, to talk to your friends, to chat with them, to cheer them with a glass, virtually no doubt, but that adds a calm once you get all the stresses out of your system. And when you speak to them, be frank, express yourself. It doesn't matter, because the stress that you have is the stress that they have. And sharing this itself will give you a calmness. Number 3, eat healthy. I can tell you that there can be a vicious cycle, and I've seen this in many people who start binging, put on weight, feel lousy about putting on weight, binge more, put on more weight, and there is a vicious cycle. Do not get into that. You will feel well if you stay fit and eat well. You will also be able to sleep better. Sleep patterns getting upset has been one of the biggest issues of the new way of life. But we can fight it. We need to fight it and get to the better of it. I know, my friends, that this is the way that I have handled this. I have never succumbed to taking medication, because medication is only required when there is a serious kind of emotional imbalance. But short of that, and short of sleeping pills, all that I have mentioned has helped me immensely in the months that have passed. And I wish and pray that you do the same. Lastly, those of you who believe in God, please submit yourselves to prayer and music. Music has a very salubrious effect on the mind, and prayer transfers the stress from you to God. And that is something that I, because I'm religious, practice. But that is up to you. And it doesn't matter which God. Your God is the best God. And pray to him or her for the calmness and peace of mind that you so importantly deserve and require at these points in time.
Thank you, Dr. Jairam, for that wonderful answer. One of the aspects, we talk a lot about COVID, but the rest of the diseases in India are not going away anywhere. The cardiovascular diseases, the neurological diseases, the hypertensions, diabetes, all these diseases are lurking. And some of these diseases have even, worse odds than COVID has. In a particular hospital, a large chain from where you have significant experience in, there are specialists which cater to a lot of these other sort of diseases. Right now, COVID has taken a significant of the capacity of these hospitals. What, in your opinion, are ways how India's health system can deal for a potential wave 3 or a wave 4, where it's a accumulation of both COVID and non-COVID that will factor in, because these backlogs are adding, and at some point of time they will bear fruit. So your thoughts on that, sir?
Sure, Siddharth. This is something that is extremely important and not to be kind of ignored. In fact, I would say that although we've had a large number of deaths because of COVID, one must understand that the deaths due to other diseases continue to remain, and in fact will rise if they are not controlled properly. Number one, we need capacity building. It's easier said than done. We can't produce nurses and doctors out of thin air, but we can ensure that we use available manpower to expand that number. Let me give you an example. It is possible for us to create frontline workers on the medical side from final year medical students who no doubt have not passed, but who can, like home guards, come to the fore when required, and they can be trained in managing certain conditions. So also nurses who have not completed but who have finished their course or in their final year. When there is a pandemic, when the demand is very high, for a specific period of time, these people can come there and help. But that means they must be trained. Now, what do they need training in? They need training in two things. One, the correct management of COVID, because they could fall under two categories. A, and the bigger group will come under the category that requires to handle COVID. B, and the smaller group would come under the non-COVID category. Those who handle non-COVID would have to have some degree of knowledge of this standard of care in the management of chronic non-communicable diseases, which is the biggest burden. So these NCDs have a fairly clear-cut way in which they have to be handled. And this can be managed at the primary care level by these people, either in person or more importantly, with the use of simple telemedicine apparatuses. I can tell you, push comes to shove, we can use this WhatsApp to do a teleconsult. It doesn't cost anything. And most of India would be familiar with WhatsApp. Hopefully their privacy policy will allow it to continue. But that is the easiest and simplest way in which we can communicate. There is a second thing. All people with NCDs will have to become adept at understanding how to manage their condition. Whether it is in the village or in the city, how one checks one's own blood pressure needs to be knowledge imparted at the same speed and rapidity as masking. Because if you measure your BP and it is high and you take additional medication to control it, you've done yourself huge benefits. So also blood sugar. Checking your sugar with the glucometer is not difficult. Even, as I said, the Indian in the rural areas can do this. I must pause here and tell you that we as a race are extremely intelligent people. We may not all be educated, but the manner in which we conduct ourselves, and if we compare that with other races internationally, I can assure you we are a class above. And one example that will clearly explain this to you is the way the vendors of vegetables and fruits manage their business. When they sell you produce, they don't sit and write it down. They don't use a calculator. They have it like that at the back of their hand. So as an intelligent community, as an intelligent section of people in this globe, we can impart important aspects to these people with simple pictorial descriptions and apps that we create and which can be, like the Setu app, widely imparted so that everybody comes to know. But managing these two simultaneously with COVID is important. But this should be done between waves. When a wave comes and a pandemic becomes rampant, everybody is concentrating on controlling the numbers. There is lockdown. There is inadequate manpower to address anything other than COVID. But if we create this workforce between these tsunamis, then the prescribed people can do their job very much like how at a time of crisis, each person in a disaster is told what is the action and responsibility that he or she needs to do. And suitable incentives to the medical and nursing students can be provided so that they feel more involved in this entire process. I believe, therefore, that capacity building, knowledge being imparted both to the healthcare workers as well as the population at large will help us control the non-COVID part of the conditions as well as COVID. And people should self-learn how to know more about their disease and what they can do by themselves to control it.
Thank you, sir. The virus, as you pointed out, has shown significant mutations over the last 6 months. A lot of research is being undertaken on what the future shape and which direction the virus is taking. One of the big worries in recent time has been the spread of this virus away from the cities into more rural parts of India, where you don't have that much of infrastructure or human resources at your disposal. What are some of the lessons that we can take from the last 14 months and really innovate to be able to fortify the front lines, particularly as you move away from cities, sir?
There has to be a concerted action between the government and the private healthcare providers in the rural areas to do exactly what was carried out in the urban centers, with one major difference. In urban centers, there is home isolation, there is COVID care center, there is hospitalization, there is ICU. But in rural areas, you can understand that a village will probably have a PHU or some clinics, but nothing more than that. So a communication and a method of transport has to be arranged between that and the district level, be it a government hospital or a private institution, so that the simpler cases, the milder cases, are treated at the village level, and the more serious cases which require medical attention are moved to a higher center. Again, I would say that the use of technology is very important. We need to empower people who may be, the workers, not necessarily qualified doctors, but who know basics of medicine. It could be midwives, it could be any of the others who know the difference between a rapid pulse and a regular pulse, oxygen concentration and so on, and empower them to use a phone or WhatsApp to communicate with the doctors at the higher center. We don't have time or the capability to build this technology in a very sophisticated way. And I don't believe that we should waste time trying to do that. We have enough instruments in our command right now to be able to do this. The next is for us to ensure that vaccination is actually directed to the rural part of the country with greater speed and efficiency than it is today. It is very important because that is the only way we can protect our people over there. In between the pandemic, when the last wave kind of subsided, I'm sure many of you would have taken the liberty of a short travel by road just to get out of that boredom. I did too. And in one visit that I had outside of the city, amongst the villagers, I found very few people actually wearing a mask. And even a less number practicing hand washing. So we must understand that this is something that also needs to be imparted to prevent this from happening. The last point that I'd like to mention is that in all this, the cooperation that needs to exist between the government healthcare providers and the private healthcare providers has to be at the best possible levels. It is not possible for either member to be able to support this at all. It has to be a combined and concerted effort.
Sir, one of the things that COVID has brought out is this entire disaster level preparedness. There's a need for us to, really maybe simulate the potential disasters in future and have robust supply chains that hold up during a period of scarcity, so that critical, life-saving supply chain is not interrupted. What do you think are some of the vital lessons that COVID has taught us over the last few months? And what lessons we can build? What are some of the things we can build upon in future, so that we avoid that situation from repeating again?
We have to invest in research that tells us what are the likely ways in which the next pandemic can hit us. We don't have that knowledge, and to some extent, it can only be a guess, not just now, but even with research. In other words, an unknown enemy can hit us again in the future. But we know certain things. Now, of course, the raging controversy of where the virus originated remains. But for most of us, we believe that this is a zoonotic condition which never affected mankind, but affected animals, and jumped to mankind because animals were being indiscriminately destroyed and the virus did not have a host. So more zoonotic conditions are likely to follow. We also know that this virus is transmitted by droplets through air and, of course, by contact with an infected person. We don't know what the next pandemic could be. It could be through the digestive system, it could be through the respiratory system, it could be in any which way. So we are dealing with an unknown enemy, and research and investing in research globally to understand what the likely next pandemic is going to be, or pandemics can be. It could be a combination of ABC, would be the first step and step one for us. Once we have that, we have to build three things. First, infrastructure across the globe to support this, and this has to be uniform. Today, the world is a mobile place. You cannot say that the United States is safe until India is safe. You cannot say that India is safe until Africa is safe, because movement of people is a part of life, and that will continue. And therefore, the war has to be on a global front with no boundaries and limitless. This is an absolute must, and therefore organizations like the World Health Organization have to get more teeth, have to be involved in the disaster preparation more closely with the governments, and all governments, whether it is the Chinese government, the US government, or the Indian government, have to cooperate and agree and accept that this will be something they all cooperate and do. I know it's easier said than done, but it is a must. And I am sure the maturity of understanding will enable people to say, this kind of a pandemic is a global phenomenon. And if it affects one part of the globe, it will quickly traverse to the rest. And so let's do this together. This is number one. Number two, apart from developing infrastructure, we need to create manpower. Now, this manpower will remain idle until the pandemic hits us. So we have to have doubling up of people. Let's take today, for example, an electronic engineer who's sitting at home. His contribution could still be utilized at the time of a pandemic in a particular way, but that requires training. It requires a completely disruptive thinking of how we can create a force that is available for a specified period of time. It is like enlisting in the army to say that you are a reserve force, we don't need you today, but should we need you, we'll call upon you. At that time, you'll have to wear your uniform and fight for us. And we will arm you with the knowledge and capability to do that. So please read up on that, remain vigilant, remain ready. This is the second one. Thirdly, direction of drugs and other protective equipment needs to be analyzed, understood, forewarned, and foreproduced. This is easier again with the understanding of this pandemic. There is a huge understanding of how personal protective equipment needs to be made and used. And I don't think that will differ widely, irrespective of the kind of pandemic or the kind of virus or bacteria or any other infective source hits us in the future.
Sir, you talked a little bit about innovations, and compared to last year, we have more, artilleries in our quiver, so as to say, this year. Maybe the next year, we are going to have few more, ways of fighting this virus. What do you see are some of the most promising alternate therapies that are emerging, which will push the preventive care, the fortifying the defenses against this virus closer to people's home, and possibly within the grasp of many households in the next 1 to 2 years?
Well, I think, there has to be an understanding of what causes a boost in the immunity. And immune boosters would really be what I would say would be the next important thing compared to vaccines. I don't believe that curative drugs are the answer, because that is not anticipating the problem. That is a reactive action. But what we are looking at is a preventive action. Are there any molecules towards that end today? I am not sure. Yes, research is going on. But at this point, we can't say with clarity that there is a molecule that is helpful in this regard, but I'm sure it will emerge in the long run. It is also possible that there could be cross immunization between infections. That is something that has to be looked at. And I'm trying to give you an example of how the influenza virus and the COVID virus are somewhat similar. So could it be that we have a virus that is similar to the COVID, which you can get as an infection, which is mild, and protect yourself against COVID? These are ways of the future, too early to predict, but yes, some of these disruptive ways of thinking will be what we read and understand in the coming years.
Sir, one question which is constantly emerging out of this discussion is the need to really, just to give an analogy of a football field, curative, blocking and tackling is very important. But you want to fight this virus in the front lines as far, before they come, before the patients come into the hospitals. So that message is very important, because it means thinking through our primary healthcare system, our promotive side of healthcare, the way it is in India. From a health seeking behavior perspective, do you think this pandemic has some important messages which cuts across the entire healthcare system? And what, in your opinion, are the couple of things or the key messages from a primary or a preventive health perspective?
I think it has brought out one thing loud and clear, and that is that primary care is not structured in this country, and it is lacking. Yes, we have primary, PHCs, primary care, health care centers, and we have PHUs in the villages and in cities. But how functional are they? How much are they really imparting? We have clinics run by doctors. But are they concentrating on primary care, or are they reactive? You have a cold and cough, you go to him, you get treated, then you forget about everything and you go back home. You don't continue to visit him to find out about your health. So there has to be a complete rethinking about how we deliver preventive care at the primary level. This means that you have to have structured primary care. If you ask me, there are several ways in which this can be done. But to me, the model is that there is a government or a private setup which has a doctor or doctors along with nurses. And what really happens is that they have a community. They have a population of X number identified by Aadhaar who belong to that primary care physician. And that primary care physician is responsible for their care. This means that it is a community that he is responsible for. And he has to be set targets. He has to be told that the HbA1c of this, that is the diabetic figure that explains how well the diabetes is under control, in that community has to come below 6 within X number of months or years. And that target should be set. There should be a clear understanding that the hypertensive in that community need to have blood pressures monitored, recorded, and accountability of the physician and the person involved needs to be there. And this is easy to kind of implement if you incentivize. Now, all of us know that insurance is the way forward. If a person is told that if your diabetes is out of control, you will lose your insurance, that is disincentive enough for him to say, let me keep this under control. If the doctor is told that your remuneration is based not on how many hours you work, but how effective your hours are in controlling these non-communicable diseases, then he will completely change the way that he works. Now, apart from this, the same set of people have to be used at times of need. No doubt they may have to be augmented, but that principal physician should be responsible for the health and welfare, the preventive health and welfare, both in terms of the non-communicable diseases and if a disease should strike, for that disease as well. Cut, copy, paste this across villages, towns, and cities, and have a structured way in which you refer these patients to secondary and tertiary care centers at times of need. Today, if I have a headache, I walk into the best hospital in the city. I don't go to a primary physician. Who does? I mean, let's be honest to ourselves, because that system is not available in a structured way in this country. I'm not saying it is the best, but do we need it? The answer is yes. And that alone, in my opinion, would be one of the biggest things that we can achieve together as a combined private government healthcare force.
Very, very well put, sir. We are almost at the end of this session, the time that is allotted. But I would like to request you for some thoughts and guidance around where you think one or two areas where NatHealth as an organization, as an ecosystem, could focus on, both during this pandemic as well as some of the lessons that are emanating out of it to move the agenda forward.
First of all, I must say that NatHealth has done a lot of work in the last several years, and I would compliment the people behind it who have really worked hard to kind of project the voice of the healthcare industry to the government. And I think that is much appreciated. But is there more we can do? The answer is certainly yes. I think that the agenda that we can really keep for ourselves as NatHealth, and I consider NatHealth to be my organization. Since I'm one of the founder members, I'm very proud of it. And I indeed compliment, and I have to mention Dr. P.C. Reddy's name over here, who was the thought process behind starting the NatHealth organization. And I salute him for the kind of leadership and thought process that he had in creating this. But let me say that we need to sit across the table with the government, form a core team, and work on the creation of a healthcare service for India, which clearly defines the roles of the private and public sector at the primary care level. We need to change the complete way in which people access healthcare. We need to ensure that a general practitioner or the primary care physician refers a patient to a hospital. And we need one other person to sit on the same page and accept this, and that's the insurer. If the insurer works with this team and we work on this for maybe a year at least, because it's not easily done, we can create a blueprint of something that will completely change the nation's healthcare. And disruptive though it may seem, it will accomplish the end result. Primary care for every single Indian citizen in a structured way with evidence-based practice, and the same practice, whether that person or the doctor is a private practitioner or a government doctor. Why should there be a difference? I think both these people should work hand in hand and yield the same results. This should be at the urban level, the semi-urban level, and the most rural level, and should not change. If we do not have a doctor, we need to see whom we can use in the place of a doctor, or create a force that will provide care at the village level through telemedicine. But a community's health has to be the responsibility of not just the community, but the primary care physician who deals with it. And then there should be a structured way, excuse me, in which this reference takes place to the higher centers, to the secondary care center, and to the tertiary care center. The government should not stop looking at how to augment secondary and tertiary care centers. They are required, but not in the metros. Our metros are enough equipped with good and excellent hospitals. And towards that end, private care must be incentivized to move this at the district and taluka levels. In other words, a workforce through Nat Health that can cause the creation of a document which will be the way of the future for Indian healthcare is, in my opinion, one of the biggest responsibilities that Nat Health can undertake, and for which it will be remembered not for now, but forever.
So thank you so much. This has been an excellent session. Your suggestions, ideas, and illustrations are very, very valued. And I'm sure everybody who is listening to this particular program have benefited tremendously out of this discussion. We are very thankful to all the frontline our colleagues who have sent us the questions in advance. For those who could not join this session, we have recorded this session. We have created a microsite where this entire session would be, the key points would be transcribed. And we will do our best to see that the message from today is carried out to every single healthcare workers. And we look forward to seeing you again tomorrow at 4 o'clock. We have our next session with Dr. Shravan Subramaniam, Managing Director of Wipro GE. But Dr. Nandakumar Jairam, we thank you from the bottom of our heart for taking the time. And we certainly would take your help and your guidance in some of the suggestions you have outlined today for all of us. Thank you for that. And to everyone, have a pleasant evening. Thank you. Namaste.
Thank you, Siddhartha.
Thank you.